Hi, in this video, I will be talking about how to communicate effectively with your medical team. But before I do, let me encourage you to subscribe to this channel if you haven't already. So you see lots of different providers, lots of different types of people on your medical team. What I'm going to say applies to everybody that you see along the breast cancer treatment experience. One of the first things I recommend is that you come prepared. Know what you would like to get out of that visit or that telephone call. So figure out what will make that visit worthwhile to you. Do you have questions? Do you need a plan going forward? Are you unhappy about something? What would you like to get out of that encounter, whether it's an in-person visit or a virtual visit or a telephone call, or frankly, even a portal message? Decide what it is that you are looking for. If you can, I recommend that you write your questions down and don't stack a bunch of questions together. Try to break each question down, and if you can, try to organize them. So if you have a bunch of questions about the timing of different treatments, put those together. If you have a bunch of questions about the reason for different treatments, bunch those together. It'll just help the conversation flow more freely. The next thing I would recommend is you consider having somebody come with you. And just like you've decided what you need to get out of that visit, encounter, portal message, or telephone call, tell the person you bring with you what you need from them. So if you need them to take notes, that's a terrific thing. First of all, it keeps them from interrupting you, and they can write down all their questions and things that your medical team members might say to you. That can be really, really helpful. Then, if they have questions, they get to ask those too, but towards the end of the visit. And if you have set questions that you'd like to have answered when you leave, write those down for the person with you. And then they can ask permission, can I mention you had a couple other questions? And letting them know what would be most useful is the best way to avoid frustration and also get the most out of their coming with you and accompanying you to your appointment. If you're sending a text portal message to your medical team, you can have somebody read it and say, does this make sense? That's a very useful thing to do. It'll eliminate the frustration of a medical provider answering a question correctly, but not the question you asked. The second thing I would recommend in terms of big groupings, the first is come prepared. The second thing is be assertive if you can about asking questions. Now, I do have to say, I'm a physician and I will often not feel comfortable asking my own doctor questions. There's a power differential, I don't know, I know they're running late and I don't want to hold them up. So I often will go in with my questions all written down, and my doctor can see those right from the beginning. So she knows I have questions. There's no need to hide them in your pocketbook or a briefcase or your pocket or on your phone. That just doesn't make the visit as helpful to you. When you are asking questions, make sure that you understand the answers. There's something called teach back that we're supposed to do with our patients, where we explain something and then we ask you to tell us back what you heard. I find that a little patronizing, to be honest, like I'm being quizzed. And a lot of patients don't like that. They feel put on the spot. And if there's some things they aren't entirely clear on, they feel they're failing. To be honest, if you don't understand something that's been said to you, it's actually a failure on the part of the person doing the speaking. It's not your fault. Conversations require both utterances, things that are said, and things that are heard. So you don't need to think about the medical profession and patients to see how this can go wrong. There are lots of jokes on TV or radio about people misunderstanding things that have been said and then doing something that wasn't what was recommended to them. So it's very reasonable for you at the end of your appointment to summarize what you've heard. Be as assertive as you can. You are taking care of yourself. And for me as a clinician, I love it when my patients ask questions because I know where I hit the mark and where I need to do better with that patient and also with others. There is a lot of jargon. There's a lot of jargon in your profession. In your work, no matter what you do, you use terms that if you talk to me, I wouldn't understand. So it's not that we're dumbing down our explanations, it's really that we're translating them. So if I go into a hardware store and I ask for a part and they tell me, well, for that you're going to need a Canuter valve, I could say, oh, okay, thank you. Or I could say, could you explain please what a Canuter valve is? Just so you know, there's no such thing as a Canuter valve. But you want to summarize what you've heard. That helps us translate our own jargon. We slip into jargon all the time. We use words like adjuvant and residual disease and partial response. These are all jargony terms, and how you would be expected to know that, I'm not sure. Of course, you've probably learned a lot watching the Yerbba videos, and just another reminder to subscribe if you haven't already. But many people haven't, and if you're watching this on behalf of somebody else, how would they be expected to understand our jargon? The next thing, and the final thing, is to feel free to give feedback. What I would say is if somebody spent time with you and explained something in such a way that it was helpful, make sure to let them know that. We spend extra time making sure people understand what we're saying. So if somebody does a really good job explaining it, or they use a metaphor that's helpful, or they draw a picture that's helpful, make sure you say, this was really helpful. This drawing, this metaphor, that explanation was really helpful. Why is that important? Well, number one, it lets me know how you best learn. So if you learn by analogies or metaphor, I will use those with you in the future. If you need a picture and you tell me that's more helpful than anything else I've done, I will always make sure to write things down for you. Some people take the stuff we write down and throw it away and would rather learn a different way. So conversely, if we don't do a good job explaining something, you can say, I really trust you, and what you tell me is what I'm going to go by. So it's really important I understand this, and I'm finding that a lot of the terms you use are not ones I'm familiar with. So just like we want to give positive feedback and let our medical team know what's helpful, we need to let them know what isn't helpful. We forget, as I'm a physician, but nurses, pharmacists, we forget what it is we've explained before sometimes. We forget how you best learn. And so you have to let us know if we're not doing a good job. Otherwise, we're going to sally forth thinking you understood absolutely everything we've said. I've covered a lot in this video. I hope it's been helpful. Don't forget to go to yerbba.com for your personalized report. We go through a lot of things on our Instagram channel. And once again, don't forget to subscribe.